These are offered routinely to all women and birthing people in the UK at least twice during their pregnancy. Once between about 10 and 14 weeks of pregnancy, this is called the dating scan, where they'll check the size of the baby and see when they would expect your baby to be at the 40 weeks of pregnancy gestation, or your sometimes called your estimated date of delivery. And they'll check that that's against the dates that you have recorded or that you're expecting, perhaps against your period. They'll also look at 18 to 21 weeks, where they offer you a scan which basically checks for any abnormalities of the baby. So it's really important to remember that these scans are important medical examinations. So it's a good idea to have someone with you, because sometimes they can find problems with the baby, problems with the pregnancy, and it might be good to have someone else with you for support. So we're going to talk through why they're offered, what they are, and how they may be taken, just to give you a good idea of what's going to happen when you go for your ultrasound scan. Now, bear in mind, I've given you sort of two of the routine reasons, but ultrasound scans can be offered for different reasons as well. You might, for example, be offered one if there's any concerns about the growth of your baby at any point in your pregnancy, or any reason to suggest that it might be something that we need to monitor the growth of your baby. They could be offered to check whether your baby is bottom down or head down late in pregnancy, called a presentation scan. So there are different reasons as well that these might be offered to you. That might be if they suspect you're having more than one baby, and another reason might be if they're concerned about the position of your placenta, for example, if it's low lying or not. So they might want to check where the placenta is as well. So what is an ultrasound scan? Well, they're going to look with a probe on your tummy, and what they're going to use is, usually it's quite warm actually, the gel on your tummy, and then they're going to press on the probe, and that sends sound waves through to your uterus which reflect back, and those sound waves enable them to have a picture built up of the baby. So when you go to your scan, you'll probably find that the room's going to be quite dimly lit. This enables the sonographer to be able to see a picture of your baby. So you'll go into the room, and the sonographer will usually have a computer opposite them where they can see the pictures coming up, and you'll be asked to lie on a couch where they'll use the probe and run that across your tummy to get the pictures of the baby. It might be that if you feel like you'll feel quite exposed, if you were wearing a dress, for example, and the dress was pulled all the way up to expose your tummy, that you might want to wear trousers or shorts or a skirt with a t-shirt, just to bear in mind. Or of course, if you do want to wear a dress and you want your legs covered, you can ask the sonographer to put some paper over your legs as well. It just depends on how you feel about feeling like your legs are bare like that. It can be a bit uncomfortable when they're pressing on your tummy to find a good picture of the baby, and they'll usually ask you to attend with a full bladder for most of these scans as well. So do check if they need you to have a full bladder or not before attending. So that can also be a little bit uncomfortable, and sometimes if you don't like the sensation of wetness, you've got the sensation of the gel on your tummy as well. So do think about these things, and if you think you need a little bit longer or things doing in a slightly different way, do discuss this with your sonographer. Now, it'll either be a sonographer or a midwife sonographer. That's a midwife who's been trained to do these examinations, and sometimes the obstetric doctors will be performing the scans as well for you. So remember, they won't necessarily be able to tell things like the sex of your baby. This isn't something that's routinely offered. So don't go with that expectation, although it may be something that you can ask the sonographer if that's something you want to know, if they're able to see that or not. The scan usually will take about 20 to 30 minutes, so give yourself enough time. And unfortunately, children aren't generally allowed into the scan room. So if you do bring a child with you, have somebody who's going to be waiting outside with the child in the waiting area, because they probably won't be allowed in most hospitals anyway. It might be as the basis of the result of the scans, they may want to offer you further testing. It might be that the scan isn't showing them everything they need to see on your baby, so they might ask you to move a bit, have a walk about, come back, or they might even ask to repeat the scan at another time if they can't see all the important things that they're looking at. Now, this talk isn't intended to tell you all the structures that they're checking with the anomaly scans, if I can say that right, and the dating scan, but that's something you can talk about with your midwife if you want to, and you can usually ask for some more information from your midwife which discuss the scans. Now, bear in mind, you don't have to have the scan at all, but with all interventions in pregnancy, with all things that are offered to you, it's about having that informed consent. So knowing what the benefits are, what it is that they're doing, what the procedure is, and what the potential risks are. Now, at the minute, according to the NHS advice, there's no current known risks to babies or to birthing people from having these ultrasound scans. But obviously, common sense suggests that you just have them when it's appropriate to have them, and you're not having them excessively either. So in terms of what the sonographer might be seeing, it might be helpful for you to have a discussion with them beforehand as to whether you'd prefer them to tell you what they're seeing as they go along, or whether you're happy for them to wait at the end, and just to ask what their face might look like when they are doing the scan, because sometimes you might be interpreting that they've got a serious face. You might be worried that this might mean there's a problem with your baby, whilst in actual fact the sonographer knows they just have a serious face when they're concentrating and they're checking everything. So just having these open communications about your neurodiversities and any needs that you might have with that will be helpful. Now, in terms of getting a picture, some hospitals may even offer a picture from the scan that you can purchase, but speak to your midwife before you go to the scan just to check if you need to bring any coins with you, or if that's even something that your hospital offers.